What do public health, progressive politics, and podcasting have in common? Let's explore Abdulrahman Mohammed El-Sayed's journey. Hi, I'm Leah, feeling curious today and eager to dive into our topic.
And I'm Garrett, ready to explore some fascinating insights with you. Welcome to Laid Back Learning with Leah and Garrett.
Today, we're unraveling the story of Abdulrahman Mohammed El-Sayed, an influential figure in politics and public health, and how those worlds overlap in some pretty unexpected ways.
So, quick story. I was at a public health seminar a while back, and a speaker walked us through how a city health department can, literally change life outcomes for kids by tackling basics: clean air, safe water, and even making sure students can see the board. They highlighted Detroit's work under El-Sayed, and I remember thinking, wow, policy is not just paperwork. It's glasses on a kid's face and lead tests in a school sink. That lens, where health data turns into action on the ground, totally pulled me in.
Let's set the scene. Abdulrahman Mohammed El-Sayed is a progressive Democrat and an epidemiologist. Epidemiology is basically the study of who gets sick, why they get sick, and how to stop it from happening to more people. He served as Detroit's health officer starting in 2015. That mattered because Detroit had gone through municipal bankruptcy, which is when a city legally restructures its debts, and core services had been hollowed out. He stepped in to rebuild a public health department that had been outsourced during that crisis, bringing essential functions back in-house.
His academic background really shapes that approach. He earned a DPhil in public health at Oxford as a Rhodes Scholar, which is a prestigious scholarship to study at Oxford, then got an MD at Columbia. Instead of getting a medical license and going into clinical practice, he chose public health, aiming at population-level impact. He also taught as an assistant professor at Columbia and led programs in systems science. Systems science, in plain terms, studies how parts of a complex situation interact, like how housing, pollution, and jobs combine to influence health. That, not gonna lie, is a pretty good blueprint for turning research into city-level action.
And politically, his platform lines up with that evidence-first, fairness-focused vibe. He backs Medicare for All, which is a proposal for a universal, single-payer health system so everyone gets coverage. He pushes stronger antitrust enforcement, which are laws that limit monopoly power so markets stay competitive. And he's known for refusing PAC money, meaning Political Action Committee cash, to signal he's funded by people rather than corporate interests. That mix places him on the progressive side of the Democratic Party.
All right, beginning of the story. El-Sayed grew up in southeast Michigan, born in Rochester Hills to Egyptian immigrant parents. That Michigan-Egypt thread runs through a lot of his identity. In high school, he captained teams in wrestling, football, and lacrosse, which, hints at early leadership. He studied biology and political science at the University of Michigan, graduated with highest distinction, and even gave the commencement speech. Then he headed to Oxford for that DPhil, captained the men's lacrosse team there too, and earned a full blue, which is like top-level varsity honors at Oxford. After that, he earned his MD at Columbia. And here's the pivot. He chose not to pursue a medical license, deciding he could make a bigger difference working on the systems that shape health for everyone rather than treating one patient at a time.
Middle of the story, and the stakes go up. In 2015, he was appointed by Mike Duggan, who is the mayor of Detroit, to lead the city's health department. He was 30, making him one of the youngest health officers in a major U.S. city. His team tackled a bunch of upstream issues. They pushed back on increased sulfur dioxide emissions proposed at the Marathon Petroleum Refinery in southwest Detroit. Marathon is a large oil company, and sulfur dioxide is a pollutant that can aggravate asthma. The department credited overall emissions reductions after that fight. They launched lead testing in Detroit schools in the wake of the Flint water crisis. Flint's crisis exposed how cost-cutting on water treatment led to dangerous lead levels, which harms children's development. They also provided free eyeglasses to school kids and reformed animal control to improve safety and care. That's a suite of very practical local moves that add up to real health protection. He then shifted from City Hall to the campaign trail. In 2017, he left the department and ran for governor in 2018, challenging the party establishment with a progressive platform. He refused corporate and PAC donations and still raised more than $5 million from individuals. He got endorsements from national progressives like Bernie Sanders, who is a U.S. senator known for pushing Medicare for all, and Alexandria Ocasio-Cortez, a U.S. representative associated with the party's left wing. He lost the primary to Gretchen Whitmer, who is now Michigan's governor, but he won nearly a third of the vote, built a statewide profile, and showed that a small-dollar, movement-style campaign could be competitive.
Now for the resolution phase, though his career keeps evolving. After the 2018 race, he launched a crooked media show called America Dissected, a podcast that connects public health to politics in plain language. Crooked Media is a podcast and media company that focuses on news and culture. He later became director of Wayne County's Department of Health, Human and Veterans Services in 2023. Wayne County is Michigan's most populous county, home to Detroit and many suburbs, so the role covered public health plus social and veterans services. In April 2025, he resigned, then announced a 2026 U.S. Senate run after Senator Gary Peters, a Michigan Democrat, said he wouldn't run again. In the primary, media framed the race as establishment moderate versus progressive, with U.S. Representative Haley Stevens representing the moderate lane and El-Sayed the progressive lane. By August 2026, the Associated Press called the Democratic primary for El-Sayed. He's set to face Mike Rogers in November. Policy-wise, he's still pushing Medicare for all, environmental justice, and strong union rights. And he holds memberships in unions like the UAW, the United Auto Workers, which endorsed him in 2026. He also rolled out a plan for more regulation of artificial intelligence companies, focusing on transparency and the risks of job loss and discrimination. In simple terms, make AI safe, fair, and accountable before it scales.
There's also his foreign policy framing. He tends to oppose open-ended unilateral military aid, but supports aid when it's within a rules-based international order, meaning coordinated through alliances or multilateral groups. That's why he supports aid to Ukraine within allied coalitions while opposing U.S. military assistance to Israel, Jordan, Saudi Arabia, and Egypt. Whether you agree or not, the through line is consistent: multilateral guardrails, accountability, and human rights considerations.
All right, here's a tough, important question that's still unsettled. El-Sayed has described Israel's actions in Gaza as genocide and called for a ceasefire. Genocide, in law, is about acts like killing or causing serious harm with the intent to destroy, in whole or in part, a protected group. Some human rights organizations and legal scholars argue the scale of civilian deaths, displacement, and infrastructure collapse, combined with certain official statements, support using that label. From that perspective, framing it as genocide forces urgency, accountability, and prevention. I lean toward acknowledging why many use that term, because it centers the protection of civilians and the responsibility to prevent mass atrocity.
I hear that, and I also think the legal threshold is complicated. International law requires proving specific intent to destroy a protected group, which is a very high bar. Many governments and analysts dispute the genocide characterization or say the evidence is not conclusive. They argue that brutal, disproportionate harm, while deeply alarming and potentially criminal under other international laws, might not meet genocide's specific intent standard. So, I'm cautious about the label, not because the suffering isn't real, but because the legal definition is, very exacting.
Why do you think the label matters so much beyond the courtroom? I mean, if the goal is to stop civilian harm, does the word itself change policy levers, or is it more about moral clarity?
Both, I think. Words shape urgency. Genocide carries a legal duty to prevent and punish, which can alter diplomacy and aid decisions. But mislabeling, even with good intentions, could undermine trust or split coalitions that you need to actually reduce harm. So for me, it's hold space for the horror, push for immediate civilian protection and accountability, and let legal bodies do their job on the specific term.
That makes sense. I still think the pattern of harm and some rhetoric we've heard justify why many reach for the genocide frame, even as courts work through standards of intent. Maybe the common ground is this: prioritize civilian safety, stop mass death, and ensure independent investigations. Labels matter, but lives matter first.
Agreed. Real talk. Protecting people and upholding international norms should not be mutually exclusive goals. That's close to the heart of it. Switching gears to pop culture. El-Sayed's show America Dissected has been a bridge for a lot of listeners between health research and everyday policy. It explains, in accessible language, how systems affect our lives, and it brings on experts to unpack complex issues. In 2026, he also teamed up on campus events with Hassan Piker, who is a political streamer known for large online audiences. That move sparked debate inside the party, but it showed an intentional effort to meet younger digital-first audiences where they are.
Yeah, and reaching those audiences matters. If your policies rely on broad coalitions, you have to actually talk to broad coalitions. Even if some collaborations come with blowback, the upside is bringing new voters into complicated conversations about health, tech, and labor. That's pretty cool, right? What if imagine he had pursued a medical license and gone clinical. He might have become, say, an academic physician leading a hospital-based clinic or a researcher physician focusing on population health trials. Patients would benefit directly, one by one, and he could still publish and teach. But the ripple effects might look different.
Totally. Without him as Detroit's health officer, rebuilding that department after bankruptcy might have unfolded more slowly or along a different path. Maybe emissions advocacy would have leaned more on environmental regulators than on the health department. Lead testing in schools might still happen, but perhaps not with the same speed or framing as a public health emergency. The free eyeglasses program could have come from nonprofits rather than the city. None of that is guaranteed, of course, but leadership style changes which levers get pulled first.
As a clinician, he might have organized physicians to unionize or pushed for hospital-level equity programs. He's been a supporter of unions, including the UAW, and sees labor rights as linked to health. So I could see him leading on safe staffing ratios, reducing administrative burden, and advocating coverage expansions from a doctor's perch. Still, the statewide runs, the county leadership role, and maybe even his podcast platform might not have emerged in the same way without that earlier City Hall chapter.
Either path centers health and dignity, but the population-level route clearly set him up to merge research with operations and then with politics. It's one of those fork-in-the-road choices that changes not just a career, but also which communities feel the impact first.
Thanks for tuning in, folks. Keep exploring and stay curious.
And remember, learning is a journey. See you next time on Laid Back Learning with Leah and Garrett.